So a lot of things, a lot of excitement for parents as far as foods are concerned, because most of the parents dream that, their children should become lot healthier, the children should be healthy, their weight should be good, and they should be looking good. So a lot of confusion about diets, what to give and what not to give. So there are some diets which should never be given especially for children below 2 years of age, because that is a time when the gut development happens. If these foods are given, they might have long-term catastrophic effects on children, especially the newborn babies. So the diets which I would recommend not to be given strictly for children would be salt, sugar, honey. So these are three things which should never be given to children directly, because already the mother's milk will have adequate amount of sodium in them, and sugar is already there in the indirect form of cereals and pulses and fruits. They can be given naturally to the children. We cannot add on to it. And honey is very dangerous because it can cause botulism in children. These are three things which should never be given to children at all as an add-on till the child completes 1 year of age. And what other things which are very dangerous, which are commonly given, are biscuits, sweets, carbonated drinks. Why biscuits should not be given? Because biscuits will be having a thing called maida, which is a highly refined bleached wheat, and so this is very dangerous, and it has got high amount of white sugar in them and a lot of dangerous chemicals present in them in order to keep the biscuit stale and smell free. So a lot of chemicals will be added to it. These all things will be introduced to children at a very young age. What does maida do? Maida causes intestinal, they cause sticking of intestine, which results in constipation. What does this flour do? This flour actually increases, it has got a high glycemic index. So what does it do? It increases the chances of obesity in children. Later on, this children might develop insulin resistance. Developing chances of this child developing diabetes is very high. Hypertension is very high. This child craving for sweet foods becomes also very high. So the more biscuits he consumes at an earlier age, probability of child becoming sicker at a later age is very, very high. So the research has been done as far as children who consume these carbonated drinks and biscuits and all, especially the foods which consist of maida and white sugar. What they have found out is children who consume it before 2 years of age, the probability of these children having obesity almost goes up by 80%. Probability of these children having diabetes goes up by 90%. Probability of these children having hypertension goes up by 70%. So we are actually, by giving all these things just before 1 year of age, we are actually, giving them bad health for the rest of their life. So if you want your babies to be healthy, if you want your babies to have a good health the rest of the life, first 2 years, avoid junk food and give them home-based diet. The probability of them having a healthy life, probability of having not craving for these unhealthy foods would be down by almost 50 to 60%. So it is always better to give them good health rather than bad health and know what to give and what not to give. So there's no point in giving these biscuits because they don't add to the calories, good calories to the child. They only give bad calories to the child. Thank you.